p.m. sharp. So before that, pin up, admit people, and all the speakers and directors or principals or everyone, pin them up so that we're ready, no? And then we start. Sharp 3 will start, okay?
Okay.
Okay.
How do you want to government?
Karna, how do you feel? Whatever you want.
हाँ जी
नंबर लेट करने वाला आने लगा
क्यों
जो अप्लाई करी थी
हाँ मेरा भी लगा
आपके भी लगा
अच्छा ठीक है
उसने भी भेजा है कुछ
highlighted.
ये
No, between like
ये
yeah.
हाँ ये देख ले यार this fella I told her that I think she is not waiting you told me
Welcome.
ഇത് ഭയങ്കര ഇങ്ങനെ വഴുക്കി പോകുന്നു ഇത് കുഴപ്പമില്ല കുഴപ്പമില്ല ഇതിപ്പോ പ്രശ്നമില്ല
നല്ലതാ.
നായർ ടൈപ്പ്
കുഴപ്പമില്ല, കഴിക്കാം. നല്ല പുളിയാ. നിങ്ങൾക്ക് ആസിഡിറ്റി കഴിക്കാം. ടേസ്റ്റ് ഉണ്ട്.
മൊബൈൽ വല്ല കോളം വന്നാൽ എടുത്തിട്ടുണ്ടോ ഇത് മൊബൈലിന്റെയാണത് നെറ്റ് മൊബൈലിന്റെയാണ്
How many have joined in, Rosmi? How many have joined in, Rosmi?
17 people. They are coming. There are still some time. Three, 4 minutes are there.
Okay.
See, a function.
Yeah.
Family Christmas, complete with classic garlands, Norman trained fireplace. Decorating angels. Top of the angels before us.
ꯅꯣꯡꯃꯒꯤ ꯑꯅꯤ ꯑꯍꯨꯝ ꯇꯧꯔꯒ ꯑꯗꯨꯒꯤꯗꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯨꯡꯗ ꯑꯣꯏꯅ ꯊꯣꯛꯖꯤꯜꯂꯒ ꯗꯥꯏꯔꯦꯛ ꯄꯨꯈ꯭ꯔꯤꯗ ꯊꯥꯗꯟꯕ ꯄꯥꯝꯕ ꯋꯥꯅꯦꯕ ꯑꯗꯨꯒ ꯑꯗꯨꯅ ꯍꯤꯡꯖꯩ ꯈꯔꯁꯨ ꯀꯩꯁꯨ ꯀꯥꯏꯗꯦꯕ ꯗꯤꯄꯔꯒꯤꯗꯨ ꯃꯄꯥꯟꯗ ꯍꯩꯗꯣꯛꯑꯅꯤ ꯃꯤꯅꯤ ꯑꯅꯤ ꯑꯍꯨꯝ ꯍꯟꯖꯤꯜꯂꯅꯤ ꯑꯗꯨꯅ ꯊꯝꯕ ꯃꯣꯠꯁꯨ ꯃꯣꯠꯂꯅꯦꯕ ꯍꯧꯖꯤꯛꯀꯤ ꯃꯆꯥꯗꯨꯅ ꯑꯣꯏꯅ ꯄꯨꯔ ꯂꯥꯛꯑꯒ ꯃꯈꯣꯏꯒꯤ ꯑꯁꯪꯕ ꯀꯥꯟꯗ ꯑꯩꯈꯣꯏꯒ ꯑꯌꯨꯛ ꯑꯌꯥꯝꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯅ ꯂꯩꯁꯦ ꯄꯨꯡ 10 ꯂꯩꯔꯦꯅ ꯑꯗꯨꯒꯤ ꯃꯃꯥꯡꯗ ꯑꯉꯝꯕ ꯑꯃꯔ ꯑꯅꯤꯔ ꯑꯍꯨꯝꯔ ꯑꯗꯨꯝ ꯄꯨꯍꯧꯔꯒ ꯅꯠꯇ꯭ꯔꯒ ꯅꯨꯡꯗꯥꯡꯋꯥꯏꯔꯝꯗ ꯑꯗꯨꯗ ꯄꯨꯔꯒ ꯅꯨꯡꯇꯤꯒꯤ ꯑꯗꯨꯝ ꯄꯨꯔꯁꯨ ꯌꯥꯏ.
Yes. Sir, shall we start?
Yes. Yes, we can start.
Sir.
Yes, we can start. Dr. Rosmi.
So we are starting today's program. Respected dignitary and other faculty joined here, a very good afternoon to one and all. Today, we are gathered here for the inaugural ceremony of a 3-month online webinar course on simulation-based medical education by MEU India on today, 18th of December 2020. Medical education has undergone significant changes all over the world. One of the reasons for the changes is a concern for the patient safety. Calls for a change in the instructional methods have resulted in innovated medical curricula. By medical graduates rather than acquisition of knowledge. So it comes the simulation-based medical education, which is defined as any educational activity that utilizes the simulation aids to replicate the real clinical scenario. Now, I invite Dr. Sanjay Bedi for the welcome address.
Thank you, Dr. Rosmi.
Before that, let me introduce Sir. Dr. Sanjay Bedi, Professor in Pathology, Atish Institute of Medical Sciences, Bathinda, Punjab. He has more than 25 years of experience in pathology, e-learning, bioethics, pathology, informatics. He has FAMA Fellow 2007 Diploma in Health Professor Education and running MEU India since 2007. He is running online courses on pathology and medical education subjects through a website, MEU India, since 2015. He has many publications in pathology, medical informatics, and medical education. He has received many awards and recognitions. He was the National President, Indian Association for Medical Informatics and Editor-in-Chief, Indian Journal of Medical Informatics. He is also the International Course Coordinator, UNESCO Bioethics Chair. Over to you, sir.
Thank you, Dr. Rosmi. Uh, I thank all the dignitaries who have agreed to give their time for this inaugural session and all the participants who have registered for this course, which is going to be one of the landmark courses, I'm sure, in the history of MEU India and online medical education in India in general. MEU India was created to overcome certain problems which online medical education was facing through creating a platform which in which faster decision maker can be done, and a pan-India connectivity should be there using the whatever is the best connectivity possible, so as to move towards the overall goal of achieving one of the best medical education systems in India through whatever possibilities technologies can give. In this, so far, over 10,000 medical teachers and another 500 general doctors in pathology, they have already taken training. Another about 18 courses are running, and every month 2 or 3 new courses are done. Competency-based medical education in every subject has been started, and first and second phase are almost ending, and third phase are starting. We invite all the medical teachers who are willing to become resource persons in any subject. We will provide them the platform, we will provide them the audience, we will provide them the experts who can work with them to rapidly move, make knowledge free.
Medical education. Inauguration.
I'm sure this course will move towards the overall objective, and we pray to Almighty that we are able to achieve this overall goal of having the world's best medical education system in India in next 5 to 10 years. Thank you, Dr. Rosmi, and thank you, Gopalan sir, and thank you, Nair sir, for giving your time. Over to you, Dr. Rosmi. We can start with the prayer with which we start all the courses, and with this prayer to Almighty that the objective of our courses are achieved. With this invocation of the Almighty Universal Intelligence in the form of a prayer. I hand you over back to Dr. Rosemi David for the Master of Ceremonies.
Thank you, sir. We are moving to the next. I would like to invite, with all the respect, our medical director, Dr. Prem Nair, sir, for the inaugural address. Dr. Prem Nair currently serves as the medical director at Amrita School of Medicine, Amrita Institute of Medical Sciences, Kochi campus. He is a skilled clinician par excellence and professor at the Department of Gastroenterology at the School of Medicine, Kochi. Dr. Prem Nair, sir, moved to Mata Amritanandamayi Math at Amritapuri, Kollam, Kerala, and voluntarily took up the challenge of setting up an affordable tertiary care referral hospital as envisioned by his Satyaguru Mata Amritanandamayi Devi. Amrita Institute of Medical Sciences is the adjunct to the term New Universalism, is coined by World Health Organization. His vision and his exemplary efforts have grown this institution into global standards in all the ranking as one of the best in India and globally too, with a state-of-art technology. Over to you, sir.
Thank you very much. Let me first of all welcome all of you for the simulation-based medical education, a 3-month online webinar course from MEU India in collaboration with Amrita. Dr. Vishal Marwa, Dr. M. Gopalan, Dr. Sanjay Bedi, and all of the distinguished dignitaries from around the country and delegates. Medical education has substantially changed since my days back in the 80s. One of the reasons for this change is a concern about patient safety. One of the hallmark, landmark reports from the Institute of Medicine indicated that medical errors is the cause of injury to 4 to 5% of the hospital patients, and perhaps 100,000 deaths a year only in the United States alone. So there's been a call for a lot of change in the instructional methods, and this has resulted in very innovative medical curriculum. The new curricula stresses the importance of proficiency in several clinical skills and not just the acquisition of theoretical knowledge. So as evidenced by many of the international bodies, it is universally accepted that clinical skills is an essential learning outcome and must be monitored carefully. The simulation is a major challenge for medical graduates in terms of application of the theoretical knowledge to the management of patients. So application of textbook knowledge to management of patients is a complex effort. And it is important that simulation-based learning is well established. Medical education, medical training programs should ensure that students have the necessary learning opportunities and appropriate methods. And it involves not just mannequins in a mannequin lab or a clinical skills center. It includes communication skills, history taking, professional attitudes, awareness of ethical basis of healthcare, physical examination, procedural skills, clinical laboratory skills, diagnostic skills, therapeutic skills, resuscitation skills, critical thinking and reasoning, problem solving, teamwork, organizational skills, management skills, information technology, research methodology, all of which are really skills that the student must learn by the time he or she finishes the medical curriculum. Traditionally, we have always said, see one, do one, teach one. This is the apprentice style of teaching and learning, and does not really help significantly in student learning. This apprentice style learning is an old method of teaching where, because of the concern of the quality of patient care and safety, we have moved away from that and focusing more on developing these clinical skills and optimal performance of these clinical skills and many reports. So with that brief word, let me once again welcome each and every one of you to this important medical education program. Thank you all very much for participating. Thank you.
Thank you, sir. Thank you, sir, for the words. We have to change from see one, do one, teach one method into see one, practice many, do one model of success. Next, I would like to invite our beloved principal, Dr. Colonel Vishal Mawa, for the felicitation message. Dr. Colonel Vishal Mawa, Principal, Amrita School of Medicine, Amrita Institute of Medical Sciences, Kochi. He is also the professor at Department of Rheumatology, and he has been served as an excellent medical officer and received many awards, military and civil. As Chief of Army Staff Commendation for Meritorious Service in 2012 and Manakial Silver Medal MD General Medicine in 1995. Despite of his busy schedules, he is showing keen interest to teach all the graduates, medical graduates in the Amrita campus. Over to you, sir.
Thank you very much. Dr. Prem Nair, Medical Director, AIMS Kochi. Dr. Bedi, Dr. Shah, Dr. Pradeep, who have joined us today. Dr. M. Gopalan, Dr. Girish Kumar, Dr. Princey from our institute. We welcome all of you. I welcome all the participants who are attending this program. It is a great privilege to address you all today. I wish all of you the very best in this course, as it looks to be a very interesting course, and I'm sure as the course progresses, there will be a lot of gain for everyone. Medical education, as we look at, I think sometimes, I know there are a lot of things to be taught. There are a lot of, skill-based things happening. One of the places where I really feel when I talk to the students, especially the final year, sometimes I really feel, what is happening. Most of our students, when you tell them, how do you manage a case of status epilepticus, if you ask a final year, student, somewhere, they sort of not very comfortable answering a question like that. Somewhere I think, in addition to our clinic, somewhere they need to, get into the wards and, get that hands-on and at least see what's happening. I think somewhere, I'm not talking at internship level, I'm talking at from the 3rd semester to the 9th semester. I think we have our limitations there, because if when you said, sometimes I've done my MD in general medicine, then I did rheumatology. When you talk of a common condition, you will find the, somewhere the sync, it's not in sync actually. I think there are a lot of things which come, in your mind as to where, we can really improve the things. So I think this course will be definitely a huge advantage for all the students and all the participants. It will give them all the faculty also, because it's very important. Finally, they say communication is not what you speak, it is what the other man understands. You got to make them understand, and that's somewhere we need to really work on. I close with an Amma a quote from one of the Amma's quote, our Sadguru Mata Amritanandamayi. We are not perfect when we are born, but we progress only through action. So I'm sure that the action which will be there will definitely take all the participants forwards. Thank you very much.
Thank you, sir. Now we are moving to the course content. For that, I introduce Dr. M. Gopalan, sir. He is the lead facilitator for this course. He is the man who needs no introduction to this audience. But yes, he is the head of the Department of Clinical Skills Simulations, Medical Illustrations, Digital Health and Telemedicine, Amrita Institute of Science and Research Center, Kochi. He has been teaching human anatomy and clinical subjects for the undergraduate, postgraduate students of medicine, dentistry, and nursing for the past 40 years. Since 2012, he has started giving training in various medical, surgical, ortho, obstetrics and gynec clinical skills to UG, PG, nursing, and allied health science students in the campus. He has received intensive training in SBME from simulation centers. For the first time in India, a simulation web base has been introduced for teaching surgery PG students on animal visceral organs incorporated in human dummy mannequins. He has broad expertise in medical sculpture, artwork, and has constructed a number of 3D illustrative models using various media. He's a national and international award holder for his innovations in the medical teaching techniques, illustrations, different clinical skills, and simulates. He has conducted workshops for basic sciences faculty members at the 8 nodal centers in India to train them to make them illustrious teaching aids. And he is popularly known as Frank Netter of India. Over to you, sir.
Am I audible?
Yes, sir.
Respected Medical Director, Principal of Marwa, Dr. Sanjay Bedi, Dr. Princey Madam, and all the dignitaries and all the participants who are attending today. Simulation-based medical education, you know the definition. It's the educational activity that utilizes simulation aids to replicate clinical scenarios. So why we have to make a course like this? We have been teaching since long time all the various clinical skills to the undergraduate students and to house surgeons and all other doctors on the live patients. And while doing so, there are a lot of medical errors that can happen and to the extent of killing the patients. And this new technique has been introduced in Western countries since long time. And in India, it has been made mandatory from 2010 onwards. But it has been made, it took long years. Since 2019, it has been made compulsory for all the medical colleges to have a simulation center, and it should be taught. All the skills are to be taught in the mannequins, and before touching the live patients, all these undergraduates should undergo an evaluation in this field, and then only they will be allowed to touch live patients. And we are making this course, and we are making instructors for the various medical colleges all over India, and we will be introducing the various different types of low fidelity and high fidelity software driven mannequins. And the teachers who are going to teach the students should go through the detailed aspect about these various devices, and they should know how to set them before starting a class. So teachers should be able to detect any faults in that working pattern of that mannequin or instrument, and you should be able to reset and repair it before starting a class. So we are going to produce a group of teachers by starting this course, and once they finish our training, online training using various videos and all, and when they set back with their own mannequins in their institutions, and they can train certain technicians along with them, so that they will help you while setting up these things for the various classes. So many simulation applications involve artificial patients that can show symptoms and respond to simulated treatment. So that way we have made an innovation. We have made talking mannequin here, and we will, during the course, we will be telling you all the techniques how to make it an interactive mannequin, so that it will behave like a patient. You can take history from the patient, and you can ask leading questions. He will give you the answer for the diagnosis of a particular problem. So, and they respond to a simulated treatment. If you give injections, it will respond by the ECG and so many other things. It will respond, and so it allows practitioners to hone their skills without putting patients at risk. So patient safety is the most important thing, and we have started our simulation center in 2012 in a full-fledged manner, and we used to have regular classes for our third sem, sixth sem, and final year students. We have got regular posting for them as well. We have started PG training program in laparoscopy, arthroscopy, as well ultrasound on the mannequins. So for the first time in India, we have an improvised wet simulation lab where we use the animal viscera, and the individual, the particular doctor will be having that the same feel of human structures. So we will put everything in the anatomical position. We will buy the viscera of animal, and we will put, and we have a manufacturing unit of making this dummy, empty dummy, where we can incorporate all these viscera and do surgery. So so since it has been made compulsory since the last 2019, our Kerala Health University has started a certificate course last year, and faculty members, including me from Amrita, have been going there in the university and teaching. And we have made a 1-year certificate course, and that is over. We have trained so many teachers, from 2 teachers each from all the Kerala medical colleges, and this new venture is for the all other teachers from all over India. So the course contents, we are planning for a 3-month course. So it will be spread from December up to March. So Fridays, all Fridays, 1 hour, 3 to 4 p.m. And the various subjects that will be taught. So we'll be giving you an introduction about what all simulation practices are available for the various types of clinical skills. And don't think that this is simulation is available only for the clinical subjects. It is available for the non-clinical subjects also. So starting from anatomy, physiology, biochemistry, then microbiology, pathology, pharmacology, toxicology. So this will be spread from December 26th, January 1st, January 8th, January 15th. Then January 22nd onwards, we will be moving toward the various clinical skills. So starting with the various heart sounds and murmurs, and normal and abnormal breath sounds, Then January 29th, we will be having pericardiocentesis, pneumothorax aspiration, and then February 5th, pleural fluid aspiration, intercostal drainage, intubation. February 12th, basic surgical skills like intramuscular, intravenous subcutaneous injections, and cannula introduction, starting IV fluid, and taking blood for the investigations and other things. Central venous catheterization. Then we have on February 19th, 2021, male and female urethral catheterization. Then various techniques in suturing. Then February 26th, we can have a breast limb examination, abdominal limb examination, lumbar puncture, rectal examination, prostate examination. And March 2nd, we can have the different various skills that we can practice under orthopedics, and also the trauma care, ATLS, advanced trauma life support. Then March 5th onwards, a series of scenarios, emergency scenarios conducted by the emergency medicine team. We have about 8 hours class for them, and that will be all 6 acute emergency scenarios will be shown. About that, we will give for Dr. Girish to talk about that. And then basic life support and advanced cardiac life support, ECG, various identification of various arrhythmias and all. And so this will be done on the mannequins, lifelike mannequins, while doing the defibrillation. If you touch the real patient, you will get shocked. Touch the bed of the patient, you will get shocked. Same way, if you touch the mannequin, if you touch the bed, the individual will get shocked. So it is no way, it is almost 99% similar to live patients. You should know that. And then March 19th, we can have obstetrics, where you can have antenatal examination of the abdomen, and then conduct of normal labor, episiotomy training. Then March 23rd, you can have conduct of different obstructed labors. Then cesarean, of course, you can practice, you can show, but at undergraduate level, we need not do that for the time being. Then you can have a gynecological examination, pervaginal examination, biomanual palpation of the abdomen, then speculum examination. Then March 20th, you can have the simulated external eye diseases. We have about 20 big size eyes showing the external disease of the eye. And then we have fundus examination, ophthalmoscopy. So without using the ophthalmoscope, you can visualize the various conditions of the retina as well. You can use the ophthalmoscope on the mannequin to see the various conditions. So in that way, you can compare this and study. Also for the ENT examination, the different conditions of the eardrum you can have. So then, then the last day, that is that will be spreading to April 2nd, 2021. We can have a 3-hour evaluation program, evaluation and assessment, examination type, MCQ type of examination we can have. And that is the end posting exam, just like we are conducting for our students. We can have that for 3 hours. And then we can have the certificate distribution. So that is all we are planning. We spread for these 3 months. So thank you for attending my speech. Thank you all. Yes, madam. We can move on to next.
Yes. Thank you, sir. Thank you, sir. Thank you, sir, for sharing the experience and the importance of setting an SBME in medical institutions and detailing about the course from December to March. Next, we are moving to the overview of the course. Let me introduce Dr. Girish Kumar, sir, in absentia. Sir is a clinical professor of internal medicine and head of emergency medicine department of Amrita Institute of Medical Sciences, Kochi. He is one of the pioneers in the field of emergency medicine in India. He started the first emergency medicine specialty in Kerala, a trained personnel in the management of all the major medical emergencies and acute trauma cases. Now I would like to invite Dr. Arun Kumar sir, Associate Professor, Department of Emergency Medicine, Amrita School of Medicine, for the content overview. Sir?
Yeah. Good afternoon, all. Am I audible?
Yes, sir.
Yes, yes, yes.
Yes. Thank you, Dr. Rosemary David, for the kind introduction. Respected faculty members, medical director, principal sir, Dr. Princey, and other faculty members and participants in the group. Welcome once again to the simulation-based learning. As Dr. Prem Nair sir told, this is not just a mannequin course. So this is something which is beyond in the COVID scenario and the era of like restrictive learning strategies. This is something which we should practice in the current medical field, because the physical examination teaching program, the diagnostic skill teaching program, therapeutic skill teaching program, other communication skills, management skills, research methodologies, everything require one-to-one sort of teaching. But due to the current restrictions, we are not able to provide so. So this is one simulation-based learning program which gives you an edge, which gives you a more complete learning strategy to all these sort of difficulties. So I feel as an enrolled faculty here, I'm very much proud to be as a part of the faculty of this current simulation-based learning. And I feel the main advantage is more, as Gopalan sir told, replication of clinical skills. It can be repeated. The most stressing on the on how to do the procedure can be done in this sort of based learning. And as discussed with Dr. Princey, have been enrolled to teach medical and medical emergencies regarding this course. So as Gopalan sir was suggesting, we'll be arranging class scenarios, probably 8 case-based scenarios. We start with ACLS, advanced cardiac life support, followed by which we go with BLS, basic life support, and followed by which we have probably 6 to 8 case scenarios, which include 4 to 6 different systems, including cardiology, respiratory, CNS, and other probably trauma also. So we will be doing all these case scenarios on either mannequin based, or probably we can have live patients included also. So that will be our strategy, which will be distributed over a period of months, and we can have discussion post classes also. So this will be our brief plan on how to conduct all these sort of lectures or seminars. I once again thank the whole department of pharmacology, Dr. Girish, medical director and principal sir, for providing me the opportunity to have a discussion with the entire faculty and the participants. Happy learning. Thank you once again.
Thank you, sir. Thank you, sir. Next, I would like to invite Dr. Shah Chinmay Jayaprakash. He's an associate professor and now HOD in charge, GMC Bhavnagar. He has completed advanced course in medical education from PSMC MCI Nodal Center for Faculty Development. He has developed an Android application for the medical waste management and telemedicine. He has many international and national publications to his credits. He has also presented many papers in various conferences, including Introduction of Web-Based Learning in Pharmacology, an Innovative Way during NCHPE 2018 and second MUHS state level research conference at Nagpur. He has around 150 national and international research articles and has received many prestigious awards. Over to you, sir.
Good evening. I hope I am audible.
Yes,
Yes,
sir.
yes, yes.
Yeah. So first of all, thank you very much to the Amrita Institute, Principal Madam, Dr. Bedi sir, the Director and Principal of Institute, for providing us an opportunity to interact with the young minds of the India. To just give a brief overview of how the course will go and how we will be working together. So let me say that this will be a core learning because many of the delegates might have more experience having a more skill-based training at their own institutions. So this will be definitely a core learning. All the content will be shared with you in a WhatsApp, as well as there will be a separate Google Classroom will be created, and all content will be available on Google Classroom. After each and every sessions, we will be planning to upload the recordings also in the Google Classroom, so that if in any way somebody has missed the session, they can be uh, afterwards hear it and can participate in the next session. Overall, we will be also be sharing a resource material which will be useful for a future sessions. So you will be getting a pre-reading material, a deliberation on the Google Classroom as well as on the WhatsApp. And as sir has mentioned, at the end there will be a 3-hour evaluation session. So like this, we will try to have an active interaction, and contrary to other people's, because it is said that skill cannot be taught online. So I think this will be the first milestone in not only in India but overseas also, that we are going to learn more about skill simulations online with the help of distinguished faculty. And definitely this will be a learning experience for me as well as all of us. Thank you very much. Thank you all.
Thank you, sir. Thank you, sir, for introducing the class overview about Google Classroom and resource materials. Thank you, sir. Next, I would like to invite Dr. Pradeep B. Bode for the overview of the program. Sir is currently the Associate Professor in Physiology, AIMS Rajkot, Gujarat. Dr. Pradeep B. Bode is into the simulation and simulation-based training since he was in AIMS Delhi. He is AHA's ACLS BLS trainer in Kumbh Mela 2015 and trained more than 5,000 volunteers. He is actively involved in simulations-based teaching at institute as well as university level. He also completed various national and international level training related to the use of SBME using task trainers, basic to high fidelity mannequins, use of artificial intelligence, virtual reality, virtual dissection, and its use in pre-surgery planning, investigations, and monitoring. His specific area of interest in SBME is effective debriefing techniques and the use of simulation in AdCom. Over to you, sir.
Yeah. Hi, everybody. It's really nice to be here on this platform to share or discuss that has been planned for the period of next 3 months. I really thank Dr. Sanjay Bedi sir and whole team of Amrita for giving us opportunity to be part of this program. Considering the role of simulation that everybody has highlighted. It is the need of hour now. And interestingly, it is allowing us the real integration. Everybody is talking about integration within subject, within disciplines, within phases. And that too now we are crossing the faculties. That means we are now using the faculty of engineering, biomedical engineering, or computer for simulation. So the simulation is giving us opportunity of real integration. And that is more and more learning in short period of time that will last longer. So the course has been planned considering all these novel techniques given or gifted us by other faculties of engineering or the similar other faculties of psychology, psychiatry, communication, because simulation is not just understanding a task as highlighted by my earlier speakers. Simulation is all about learning what you plan to teach, how you teach, and then analyze what you have learned. So over a period of 3 months, we are going to learn whole of this simulation in that fashion, and you will really enjoy this journey of simulation. Thank you all.
Thank you, sir. We are close to the end of today's program. Now, I would like to invite Dr. Princey Louis Palati, Professor and Head of the Department of Pharmacology, Amrita Institute of Medical Sciences, to deliver the vote of thanks. She is also the head, South India Unit, UNESCO Chair in Bioethics, Haifa, National Chair Curriculum, Indian Program. She is an avid researcher, medical educationist, and bioethicist. She has many publications to her credit. Over to you, ma'am.
Thank you, Rosmi. I thank our director, Dr. Prem Nair. I thank our principal, Dr. Colonel Vishal Marwa. I thank Dr. Sanjay Bedi, who has been instrumental in arranging this platform for conducting as he has enthusiastically to promote medical education. And this time we are out with trying the impossible, trying to skill ourselves in simulations by having an online webinar course for 3 months on simulation-based medical education. I thank our co-faculty, Dr. M. Gopalan, who is with so much experience, sir, is a treasure house of knowledge on simulations, and he started it all way back when simulation was just told to be started. He had already started off with it. And we have the other faculty, Dr. Girish Kumar, Dr. Arun from emergency medicine. We have Dr. Chinmay Shah and Dr. Pradeep Borde. All are geared to, impart whatever we know, and we would be having also a lot to learn from such, from each one of the participants. So before I go into my privileged duty of proposing the vote of thanks, I would like our participants to unmute yourself and kindly tell us, at least 5 or 6, I think we can take, kindly tell us what is the reason, identify yourself and tell what is the reason and what is your objective of joining for this simulation-based medical education. Just to know you.
Please unmute yourself.
Ma'am, I'm Dr. Sheba from GMC Kannur. Am I audible?
Yes. Go ahead,
Yes.
Sheba.
Yes, ma'am.
Yeah. Ma'am, I'm very happy to join this course. Actually, I got a link from my colleague, Dr. Swarnalata, who is also there in this platform now, physiology HOD. And as soon as I saw the content, this one is regarding clinical simulation, because we are in the now in the current CISP program, and everywhere this simulation based program is a must for training the EMG, Indian medical graduate. So the faculty like us should be trained for that. Then only we can do it in our department, and also we can make it use in our college in the MEU as a part of MEU member. This one I wanted to participate in. For that sake, I'm participating.
Thank you, Dr. Shiba. You won't be disappointed as you have seen what Dr. Gopalan has put out the course of contents which he took. I'm sure you will not be disappointed. Let's go on to another of the participants.
Please unmute.
Hello.
Yes, go ahead.
Yeah, good day, ma'am. First of all, thank you very much for having me. My name is Dr. Sanjeev Das. I am working as professor and head in Department of Pharmacology, Government Medical College, Ratlam, Madhya Pradesh. Ma'am, this simulation is need of hour. So obviously under CBME curriculum, there would be a lot of simulation based practices across different courses. Secondly, actually, I have been given that charge of working as a skill lab instructor, and ours is a novice college. So everything we are going to start from the scratch. So I think this course is going to help me in all possible way to set up my own department. And thirdly, I think this will also help me to practice simulation-based activities in my department. So these are the reasons which actually attracted me to join this course.
Thank you, Doctor. All our wishes, best wishes, and you can take in all these aspects that you would be learning. Any more unwritten objectives you have, we will go through. Yes, madam, go ahead.
Good afternoon, madam, and Sanjay Bedi sir, Gopalan sir, and all of you. Basically, I came to know about this course through the group, the MU All India group. Now I'm MU member in my institute. I'm calling from Kolkata. I'm in ESIC Medical College, Joka, Kolkata. So basically, one of the major reasons is definitely the introduction of CBME as a new mode of teaching in this curriculum. I'm also part of the curricular committee in the institute. I belong to the faculty of biochemistry, so I'm professor and head of the department there. So one of the major reasons which I found, of course, is I still remember when we were interns and we used to go on palpating the patient's liver and how irritated the patient used to be. And given these days, it's even worse. And especially in our institute, it's slightly different from other government institutes because we have insured patients. So kind of, the free hand I feel the students get is not that much. And apart from that, in spite of it being a government institute, we are really running short of faculties, and it's pretty tough situation here. So I think this use of technology in a way is going to help in teaching them. And of course, I'm also part of the skills lab, part of the MU. So that I hope is going to help. I mean, I basically look at it as a marriage between medicine and technology. That is what really encouraged me to take up this particular course. Thank you.
Thank you, madam, for joining from the east corner of India. And really, we should be able to meet up with your needs. And down the line, if we have any more objectives, I think we, Dr. Gopalan and the team can come up or help you in all of these. So thank you all. Is there any other, anyone else would like to speak up?
Good afternoon.
Good afternoon. Go ahead.
I'm Dr. Pramod Goyal from Adesh Medical College, Bathinda, Punjab. I'm also actually in the skill lab in our institute. Our skill lab is in final stages. The area has been finalized, the rooms has been made, and everything has been made. So my purpose is that I will, in a better way, to play my role in the establishment of skill lab. Plus, of course, the motivation we get from Dr. Sanjay Bedi in our institute. So I'm thankful to all of you. Thank you. Thank you.
Thank you, Doctor.
Thank
I'm
you.
sure this course will be helpful to you, and you can pull off your department that you set with flying colors right from the beginning. So thank you.
Thank you.
Is there anyone else who would like to consider their objective, please?
Please unmute yourself.
Hello, am I audible?
Yes,
Go
yes.
ahead.
Yeah. I don't know whether you can see me. I don't see myself. I am very new to this thing. I'm a professor and HOD of microbiology at Jenims Imphal. I'm also the MEU coordinator. And so being coordinator, I'm also part of the curriculum committee in my institute, which is why I'm part of this online training now, because we have a new skill lab that has several mannequins and stuff that has been procured by our dean, but none of this stuff have been used till now because we don't know how to go about it. So with this 3 months of training, I have included my MEU members, one of them, and one of them is a curriculum committee member, and another one is just a assistant professor in anesthesiology. So from Imphal Jenims, we are 4 of us in this training, hoping that we will be able to start the skill lab very soon. That is our main objective of joining this training. And also, I'm so happy to see Professor Princey, whom I have met in Shillong Negrims as your, yeah, we did that bioethics training. And
Yes.
also Professor Sanjay Bedi, I have met in Jorhat when we took part in that theater of the oppressed. And I was quite an active member. Who was it? I forgot the names, but
Dr. Ramaswamy.
yeah, I remember the faces. Yeah, we did several of those theater work and all based on medical humanities. So I'm pleased to see some familiar faces, and of course, I'm very pleased to hear about the new. Hoping to learn, especially from Dr. M. Gopalan. I was hearing your speech and what all you have said. I'm very interested to know that even in the subject of microbiology, especially my subject, there is something we can learn in the simulation lab. And I'm looking forward to learning all this time. And thank you so much.
Thank you, ma'am. Welcome and greetings to you to Imphal.
Yes,
so
thank
we
you.
have conquered the whole of India, are there from all the corners of India and the center, Madhya Pradesh, Nagpur, everyone is there. So I think Dr. Bedi, correct me if I'm wrong, we have about 80 participants as of today.
No, as of today, it has crossed 100. Just there are 20 registrations today. Last minute registrations.
Okay, so we crossed the century mark, which we didn't think would happen, because starting such a course, as you would have realized, teaching a skill online is going to be a going to
landmark,
be a really
landmark learning.
yeah. To India and to the world, who will be an example, and I hope we are successful in it. We have the enthusiasm, you have the enthusiasm, so I'm sure we can't go wrong in this.
Yes.
Right? Yeah.
Good evening, madam. Can I speak, ma'am?
Yes, please go ahead. I need you.
Madam, I am Dr. Shivagami, HOD of Anatomy from Tanjore, Government Tanjore Medical College, Tamil Nadu. Actually,
madam, we can't hear you.
Yes, madam, I have a problem. Madam, can you?
Now it's clear.
Is it clear, madam?
Yes, yes.
Now I can hear you.
Sir, madam, I know Gopalan sir, and I came as an examiner to Amrita, and I was asked.
Maybe surprise.
Really innovations like in the museum. I want to do something like that.
Madam, you're not audible.
Oh, sorry, madam. I will give you in the chat. Thank you, madam. I will give in the chat box.
it possible, ma'am, for you to be audible, or would you write in the WhatsApp group your opinion? If you do, come on, do unmute yourself and declare. Until then, shall I take the time forward? And I would like any more.
Sorry, madam. There is some network problem, madam. I will do it in the chat box or in WhatsApp group.
Anybody else would like to speak? Dr. Surinder Bodh.
Hello. Good evening, madam. Good evening, Bedi sir, and this yes, and SBME, this team. Sir, I am professor, head of the department at Government Medical College, Datia, Madhya Pradesh. Last 2 years, I am working this institute, sir and madam. So in the Madhya Pradesh, here trend is that actually after the CBME, this everyone started listening regarding the significance of the simulation-based teaching. So this 3 months course, it will create a milestone for the future doctors. But present scenario, already we are aware about that in government, most of the government institute administrator also not much familiar regarding the whole this setup. But after attending this workshop, definitely I will be in the position to convince the dean or commissioner medical education to start this simulation-based skill lab in our institute. So that's the reason I joined this institute. And Madhya Pradesh, most of the institute, they don't have this simulation-based lab. So it will be good to attend this session along with us, with you. Thank you, madam. Thank you, sir.
Yes, sir. Thank you so much, sir. And our greetings go to Madhya Pradesh and all the colleges there, and with faculty like you all. I'm sure simulation-based medical education will spread over there, sir. And whether we have the facility of the lab or not, it is most important that we are empowered with the knowledge of simulation-based medical education, so that we can show at least in part or in some way how we can use with our own limited resources. And I think we can also have a session, if all of you all agree to, you can put it on the group, whether you want the simulation lab. If you wish, we can have a on that.
Okay, madam. Okay, thank you, madam. Thank you.
Okay, sir. So I think that would be good enough. So thank you all. Is there anyone who would like to speak yet? Pleasure, privilege, duty. Anyone?
I don't think there is
I go into my privilege duty. Is there? No. Okay, no hands raised. Okay, so I go into propose the vote of thanks. And for this purpose, I have to take my gratitude. And this gratitude is a sublime expression that is straight from the heart. And I take great pleasure and thanks all the dignitaries who have assembled here, especially our director, Dr. Prem Nair. Sir has been here with us, and he's always a constant, eternal source of support and encouragement. And he's such a visionary that has brought over the 20 years this institution to where it is, and any new, unheard of, even, which has some potential, so sees that and allows us to do it. And that is why we are going so forward at all times and everywhere. We are ready to take the step because our director is behind us. So thank you, sir, for always being there and guiding us and pushing us forward and giving your helping hand in doing such wonderful work, sir. I also thank our principal, most approachable and most enthusiastic sir, as you would have seen. Dr. Colonel Marwaha has always been the guiding force and the support. You know, you can ask sir for doing anything and he's there. And if you don't, he will teach, he will find out and help us in doing this. I thank you sir, for your constant guidance and support that has always been there, and the approachability by which we can come to you at any time and ask for help or for any guidance. You're always there. Thank you, sir. I thank Dr. Sanjay. He's a tall gentleman, a little over the 6 foot mark, but has such a
Ma'am, ma'am, your voice is breaking, ma'am. Sorry that we think we have lost her connection. We can wait some time. Yes, ma'am.
Am I audible?
Ma'am, can you hear us?
Yeah, yes, yes, yes.
Yes, I can hear you.
Yes.
So I thank Dr. Sanjay Bedi, who has a great mind and heart that is always there to help others be empowered with medical education. And his non-profit organization that does this is a veritable platform for bringing out such courses. And we feel confident to join up and collaborate with him. And by himself, he has done so much and it has been taken forward by so many. So he's bitten with this bug and it is so contagious like corona that we have all bitten. And I'm sure sir has got so many thousands of faculty who are trained under various subjects and disciplines and courses under his platform of MEU India. Thank you, sir, for collaborating with the Amrita Institute, as our director and principal has said, and we are really glad to be part of it. Hats off to you, sir. Salam to you, sir, for doing such great, what do you say, pro bono kind of work, sir. Thank you so much, sir. I would like to thank Dr. M. Gopalan, a wonderful personality, a treasure house of knowledge and a walking simulation and illustration. Sir, despite his age, you know, he's only so young and he's always ready. I see sir's enthusiasm and I feel very tiny in front of sir in knowledge and skill and also the enthusiasm for ever teaching. Sir is always there with us. Sir, I've known you for the past
Ma'am, ma'am, are you there? Ma'am, we can hear you. Sir, Sanjay Bedi sir, I think Prince Ma'am has lost her connection.
End it here. We'll end it with the national anthem.
Well, I would like to kindly guys.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुद्ध आशीष मांगे गाहे तव जय गाथा गण गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you one and all for being present for this inauguration of this SBME course. See you next Friday
Thank you,
at
ma'am.
the same time. And yeah, next Friday is 25th. So on 26th, we will be having class, okay? 26th at 3 p.m. Please note, not Friday. Friday is 25th holiday. So 26th at 3 p.m. we shall be having our first session taken by Dr. M. Gopalan. I thank my co-faculty, Dr. Anu, Dr. Arun, Dr. Girish Kumar, Dr. Chinmay, and Dr. Pradeep Borde also for this presence here today and being there for the whole 3 months in empowering SBME. I thank all of you. And I thank my beautiful, smart Rosmi.
Thank you, Rosmi,
Sorry,
for
ma'am, we
organizing
can
all
hear
this.
you.
You are comparing a wonderful session. So with this, I think we can end it here.
Yes.
It's recorded, no, sir?
Yes.